שיעבוד איתנו יותר. ואני חושב שמה שנראה לו הוא לא יודע עוד.
מצלמים.
Okay, so as you know, I was working with motion sickness. It was my job as a psychologist to produce some sensation of sickness in order to see who will be able to walk in the sea and to be in the Israeli Navy. So I'm going to show you what Barlow is doing in Introceptive Exposure, but even in somewhat more unique way. Barlow suggests to rotate either on chair or to do like this, like he's doing other activities. But this time I would like to do it even in a more precise way that will produce some sickness. So when I'm speaking, please think who can be my subject. It's not anybody who likes Luna Park? Amusement park would enjoy it. It's not that. The only thing we are going to do is going to rotate in a constant speed and gradually move the head from one side, from the center to the side, wait there, and then go back to the center. That's the whole process. Who can be a subject? I'll bring the chair. And Nimrod will play the psychologist who will ask the question. I'm going to be the technician right now. And Nimrod will ask the patient about his decision to come or not to come, what he felt, and so on. אוקיי. אני שוב אזמין אותך אלה בסוף.
אבל היו בזקנות.
תשעמי קצת אחורה, את הרגליים קצת למעלה, כדי שאני אוכל לסובב אותך שוב. רגע. Yes, let's go a little bit more here. רגע. Okay, I'm going to rotate your breath slowly. Yes, exactly like this. And close your eyes, please. Close your eyes. And we are going to do this. I should do it at least one moment and in a constant speed. How do you feel?
Great.
Great. Okay. Okay. Now, slowly, very, very slowly, move your head to the side. Tilt it.
Which side?
This side. No, not like this. Like this, yes. עוד מעט אני אפול. And now slowly bring it to the center. How does it feel?
Dizzy.
Dizzy, okay. We are going the right way.
How do you survive it? Tell me.
And now go to the other side with the head. Yes, slowly. What's the exact feeling?
Very dizzy, wow.
Very dizzy. Okay, we stop. Okay. And now speak with your therapist.
You can put your feet up.
What exactly did you feel?
Now I feel.
Yes. When we stop, there is usually the feeling going in the back in the wrong direction, in the other direction. But look on Chaya. And usually she's very alive. And what do you feel now?
No, it's okay. Again, I'm okay. It's just a feeling of losing control.
Yes. Yes. And there is also sometimes one can feel that he goes up like in this way. We call it the Coriolis effect. When you rotate the semicircular canal in the ear, but that's and then we weave another canal that goes to another direction. It gives the feeling of going up or down. But please do the.
Had you given me instructions before, I would have paid attention to that. Probably my attention was diverted.
Yeah.
Yeah. So the idea is to try to be, as you're doing the exercises and after and even before, to try and be mindful of what you're thinking, what you're feeling. Did you have any specific things you were feeling, thinking maybe? what did you think about when you were rotating?
I think I was, you're talking about thoughts, right?
For example, let's start with thoughts.
I felt that I could rely on you to take care of me. I mean, I trusted you.
Okay. Did you, like, it was unpleasant, right? Was it unpleasant? Or?
At the end, yes, it was
At the end.
unpleasant.
Okay, so at the end it was,
Bending the head to the side was, was,
That was the crucial element.
that was
Yeah.
unpleasant.
and did you notice
But
yes, sorry. Did you notice yourself feeling anything, when it was unpleasant, that unpleasantness came to you, was there anything how did you handle the unpleasantness? What did you do about it?
Just gave in.
Just gave in.
I just
So
gave in.
you just waited. Did you have a clear idea of this will pass? Like, did you know, like, just by experience, this is going to go away?
No, I mean, I was sure that nothing will, I mean, it's a demonstration. These are people I trust and rely on you.
So if we would have done it again, then we would go a little further, I guess.
Okay.
And we would also ask you to try to be mindful as you're doing it.
Yeah, would you be able to do it again? Okay. Before we do this again, and I want to have the highway rest a little bit more, we have in the clinic few cases of what is called in the literature emetophobia. It sounds strange, but it's the fear of vomiting. And there is a significant part of the anxiety disorder that people are afraid from to eat something that they will vomit. They're afraid to go in certain cars or airplane because they might vomit. And we tried this method, and it is very useful because we produce nausea, and the subject can now feel, okay, I have nausea, but it's not immediately that I'm dying or that I cannot vomit. Usually they don't vomit. Most cases there is a emetophobia, they are not vomiting. It's only the anxiety about it.
This is pretty common in like psychophysiological symptoms, that there is a very large, like a very wide spectrum between just the sensation and it being dangerous. So for example, if my heart is pounding, then there's like a base rate, and there's slower and there's faster and faster and faster, and all that is very healthy. But a patient with this fear will interpret a very normal range heartbeat as threatening, as he will interpret a very normal range sickness as I'm going to vomit. So that's a threatening part. That's the catastrophic interpretation.
Right.
What is this moving the head for?
Tilting the head produces this strange feeling of going up or going down. We'll see if Chaya will be mindful now, if she will feel it. Tilting the head is really to produce the sensory conflict, which is the theory that... Okay.
And I think something else that I noticed, that there was the urge of opening my eyes.
Yeah.
In order to have an idea where I am.
Yeah. Okay. So the fact that you didn't do it, if you would have done it, that's what we call a safety behavior.
Yeah.
That will lower the exposure, the force of the exposure. So you didn't do that. That's very good. But you noticed.
Yeah, I did.
There was some safety behavior. Chaya was talking and making like a joke here and a joke there. I trust
Yeah,
him.
that's true. That is safety behavior. I think this time we'll do it again.
Yes.
I think this time, because from what I see, you were pretty much with the physical sensations. Although if you have more details about them, that would be interesting. Maybe where you feel it, like maybe a little more about it. You have an opportunity to study it, to explore it. And maybe notice also if there's any emotions or any thoughts. Because that was something you noticed less this time.
Okay.
So just be with it and try to see if anything comes up.
Okay.
החלק
It's not the best chair for this.
לא, החלק שמסובב לי זה שרירי הבטן שאני צריכה לחשוב עליהם כדי להחזיק את הרגליים שלי באוויר.
אפשר להרים את זה?
את יכולה-
זה לא יבהר לי?
מה אני אעשה עם הרגליים?
לא, אבל זה הכי גבוה שאפשר. את יכולה לשים את זה על הכיסא או שזה לא ה...
לא,
אוקיי.
יש גבול.
לא חשבת על הבגדים.
מה? לא, כאילו להחזיק רגליים ככה, אני עסוקה ב...
כן. את יודעת מה, בואי תנסי שאת תהיי אחראית על דחיפה. ואז את תשימי לב מתי הרגל נוגעת. נסי רגע.
אני ארים את הרגליים.
אוקיי. Okay. Now, please notice the feeling of the sensation of the chair rotating without any other change yet. Just the rotating chair. There should be a moment that the subject might feel that she is not rotating because the semicircular canal enters such position. But it should be usually in the same speed all the time. Okay,
Now
now.
it feels as if I'm not rotating.
Okay, now rotate your head to the side. Yeah. And to the center again. What do you feel?
Very weird, as if I'm falling off the
Yeah.
chair.
Yeah.
I have
Okay.
to hold, sort of, to feel safe. Wow.
Okay. Now gradually open your eye.
I like to.
Any also gastrointestinal feeling?
No.
We'll have to work hard. By the way, also for me, just the rotating around was somewhat,
For us.
and I with this unique, yeah. Okay.
So, what happened this time? Well, first of all, what was the, I don't know, how difficult was it?
How
Difficult compared to that at the other time.
I was more aware of the need to hold, find some anchor of control.
So this exercise has a lot to do with control for you.
Yeah.
Mm.
Interesting enough, I cannot hold it. My PhD dealt with the issue of controllability in motion sickness because the question was, why does the driver is rarely motion sick and the
Well, he
passenger?
knows what's going to happen anything.
Yeah, but it's not so much, I thought it's more the feeling of control, but it's the one-to-one relationship between the controllability is not just I know that I have control, it is very sensomotor. But that's another story, sorry.
So, any thoughts, any feelings?
No, hold on, take care.
Okay.
Like,
So the way you dealt with the feeling of losing control was
holding.
holding on.
Hi, do I recall correctly, you did have in the past some dizziness period? I should have asked it, of course, before. But you were somewhat not connecting it to the, you were not afraid now from this, or she's a brave woman.
Yeah. So what will happen in very often when you do this exercise, and didn't happen here because Chaya is very whole with herself, is that you will notice a lot of criticism very often. I didn't do
Lot
it,
of what?
criticism.
Not from you, from
Yeah,
a classical
like
patient.
self-criticism. like,
Self-criticism?
yeah, you will
Like
notice a
what?
lot, like I didn't do it right, I can't do it, this is not working, why is this relevant? There's a lot of that with real patients, which is also something to notice. Like, when he was doing the exercise, was he thinking, oh, I'm not doing it right? Or was he thinking, I'm trying? I was just trying, you know, that's a very healthy, accepting attitude, let's see what happens. So we're trying to get the patient to that attitude, to let's just try, and I trust the patient.
The therapist.
The therapist, sorry.
That's the
I
main
trust.
thing, I think, that
Yeah, I think that was your safety.
You knew that nothing is going correct.
But I think Nimrod's point about the criticism of the self about himself is very important. Even in classical breathing exercise, you know, breathe from your abdomen and put the air slowly via the mouth and so on. So some patients who are obsessed, we are not doing it the right way, we are not doing it the right way. And that's a problem when you want to teach effortless breathing, but they are doing too much effort, which again brings us to the idea that Barlow suggests, don't fight. The effort to change is the futile.
So I didn't fight it, and that's probably why it passed pretty quickly, right? I think the feeling passed about 10, 20 seconds after each session. So with someone this is the frightening symptom for him, it will not pass after 20 seconds, there is no way.
Right.
It will be minutes, maybe 10 minutes sometimes, until it really passes. So this is not a classic case. Just one more small thing. It's worth to help the patient notice progress. And one way to do it is to form some sort of scale. For example, you can count how many times he did like the circle, and then count it next time and show him that he's progressing. That first, the dizziness was unbearable after 3, then after 5, after 7.
Like a mental gym.
Yeah, like a mental gym, exactly, because this is what we're training. We're training the physiology to get used to it, and the other systems to kind of say, this is okay, this will pass, I don't need to do anything about it, it will just pass.
It was not even near a sensation of something that is difficult to bear or to
Yeah,
review.
okay, so this is something you're not as sensitive to. Most people have one thing which they're more sensitive. Some people it's sickness, some people it's heartbeat, some people it's sweat, some people can't bear to be cold. Every person has like 1 or 2 sensations which they have difficulties with.
Okay, I think we have to stop. Hi, thank you very much, but
Thank you.
please wait. One thing for what Yael just said, Yael told Chaya, go very slowly, because it could be a very strong and powerful exercise. I didn't do it all the way, but one should be careful with that.
And also, sorry, I mentioned that in Chaya's case there is no pathology connected to the symptom. If there is, what happens is once you raise the symptom, the pathology rises as well. So that's also one thing that should happen with real patients.
We have to finish. Next time will be more classical CBT oriented. We'll do the Yisachar Eshet.
אפשר לעבור לעברית.
Yeah.
נכון?
בפעם הבאה